Hey everyone, this is Doc T. Thanks for joining me at the Horses Advocate podcast. I so appreciate you being here. I appreciate you commenting. I appreciate you telling others about this podcast. My goal is to help horses thrive in the human world, as you can see over my shoulder if you're watching this. And if you're not watching this, it's probably my fault because we are working hard to get our YouTube channel off the ground. It's been there forever, but we just have so much work. We're restructuring everything. Just so many things have been happening recently. And today it's all about dentistry and horses. There's so many other things that we can talk about. And I know you guys are interested, but dentistry happens to be my passion. It's my avocation. It's what I do every day, have done for 40 years, working on close to 80,000 horses. And I am way off out in the outfield someplace as my profession just continues to focus in on doing more and more what I call disruptive things to horses' teeth. And it is driving me nuts. And one of my good friends, hi, Kathy, not my wife, Kathy, the other Kathy, in Aiken, who has just been tremendously supportive and helps as an admin on the Facebook group, the Horses Advocate. She brought to my attention someone out in California who's an osteopath. And I don't believe this person is a veterinarian, but this person is telling people that EOTRH, the disease of the front teeth of horses, should not be met with surgical removal of the incisors. And say hallelujah, this is what we all say here, stop pulling the front teeth. Yet it is the standard operating procedure that a lot of veterinarians are doing. And I've always said, just because we can do it, should we? So I want to go over what EOTRH is, but I also want to look at this journal called Equine Veterinary Education. And this is the July 2023 edition, which has two interesting articles on dentistry in here that I want to go over. So we've got three subjects we want to cover today. And the first is equine odontoplastic tooth resorption hypercementosis. I will tell you right off the bat, it took me a month of memorizing that. This way I can say it in my sleep. I actually know what the words mean, but everyone calls it EOTRH. And for some reason, some people try to make a word out of that, EROTH or something like that. No, you can't. It's EOTRH. The most significant thing everyone should understand, and I hope that there are veterinarians listening to this with an open mind, and I hope that equine dentists out there, whether you're a vet or not, are listening to this with an open mind. But I want to ask each and every one of you, if you're old enough to go back to 1980, and that's when I was in vet school at Cornell, and not that I mean, the school tried to teach me everything that was going on, that they were very complete. And we used this latest textbooks. And I scoured all the equine textbooks. I own them. I still have them. I looked high and low for EOTRH as a disease in horse teeth, and it didn't exist. When I graduated in '84, it wasn't there. In the 90s, I started to see what I called ugly teeth of old horses, where you lift the lips up and you start to see some really disgusting front teeth. And I know if you're just listening to this podcast, you really should go over to my website called thehorsesadvocate.com. 3 words, thehorsesadvocate.com. Glue them all together, no apostrophe, just thehorsesadvocate.com. And then in the search bar, type in EOTRH and hit. You don't even have to hit anything. It'll automatically come up. And you can see the disease of the incisors. I have probably 190 pictures, and I just stopped adding them because there's just so many. But you can see every type of degree, from very mild to very severe to teeth absent because they've fallen out. You can also see a separate one on just the canine teeth that have EOTRH. You can see abscesses erupting from the teeth, fractures, black spots. You can see all the signs of EOTRH. Believe me, if you lift the lips of your horse and you see something that doesn't look normal, it's probably EOTRH unless your vet tells you something different. Veterinarians will take radiographs of the mouth, of the bone underlying the incisors. Remember, the incisors, that's the front teeth. You know, if you smile, the first teeth that you see, those are the incisors. They're also called the nippers. And when you look at it, you'll see anything, one or more of the following things. Inflamed gums, so they look a little bit redder. Red dots on the gums, that's pretty classic. You'll see the gums receding up away from the normal gum line of the incisors. You'll start to see a collar formation or thickening around the gum tooth junction. You'll see an increased indentation between the roots of the incisors underneath the gums. And you'll start to see an enlargement of the roots underneath the gums as the teeth are desperately trying to hold on. The reason for this is there is disease of the bones. And as the bones underneath these teeth die, the secondary effect is that the teeth fall out. And what you're looking at is a very, very, very slow process from the first insult to the final point where they can't hold on to the tooth anymore, or there's an abscess in the tooth and it fractures out. And there may or may not be pain. And the best way I can explain whether there's pain or not, there's two things you can do. If you see this disease, just lift the lips up and gently tap with your finger. And if the horse just sits there looking at you, it's not painful. The other is to offer a carrot. And I'm not a big fan of giving carrots as a treat, so don't start feeding a bunch of carrots. But as a test, a carrot or an apple, and let the horse bite it. Horses with normal bites can take their front teeth and bite into an apple or bite a whole carrot and snap it off. And horses that have painful incisors can't do that. So if they're starting to become painful, that's more of a serious situation, because the horse will first be less inclined to have a happy life, and second, may stop their ability to graze or to pull hay out of a hay net, or even hay out of freestanding hay. So they do better on things that are already chopped that they can lick up and pass past their incisors. So why do these horses have this disease? And why wasn't it in the textbooks in the 1980s? What has changed? Now, hold on to your hats, everybody, because I know what I'm about to say you've never heard before. This is a joke. I believe that EOTRH is secondary to leaky gut syndrome that's occurring at the beginning of our gut, which starts at our lips. Remember, our gut is a tube that runs through us from the lips to the anus. And leaky gut syndrome, nobody seems to be arguing with. It can occur anywhere. And leaky gut syndrome seems to be at the root of all autoimmune diseases in humans. So, I mean, I won't say it's at the root, but there seems to be a correlation, maybe not a causation, but a correlation between leaky gut syndrome and autoimmune disease in humans. And so it seems likely that when Dr. Dixon, Patty Dixon out of University of Edinburgh, who authors one of the papers I'm about to talk to you about, when he suggests that EOTRH is an autoimmune disease, I tend to agree with him. So the number one thing that I recommend is stop feeding grain and just stop the process from occurring. However, because no one has stepped forward and said, hey, doc, I've got several $1 million, like not just one, but several $1 million. I'm willing to put up 1,000 horses and get a study going here where we feed half the horses grain, the other half nothing, and we'll see if those that are fed grain have EOTRH. Of course, that's not a very good description of the study we have to do, but it gives you an idea that nobody's studying EOTRH. Nobody's doing a randomized controlled study, or what they call the gold standard for accurate data. So we're not getting that kind of information. So we don't know what is the cause of EOTRH. Another would be just doing a retrospective study where they take every horse that's ever had EOTRH and look to see what their diet was. But the problem is this could have occurred when the horse was being fed grain from birth to, let's say, 10 years of age, and the horse gets sold at 12 or 10, let's say, and then somebody says, well, we're not going to feed any more grain, but yet the condition has already started, and we don't know how this disease progresses. No one's ever done a study of taking EOTRH horse and saying, okay, every 6 months or every year, we're going to do a study such as radiographs, and we're going to see for the progression. We're going to associate that progression with or without certain materials. But I do know that in human medicine, and whether it's homeopathic medicine or whatever you want to call it, there is a correlation, a strong correlation between the feeding of mushrooms and the binding of these proteins called lectins that are in grains. And through binding them, they're passed out through the manure and they don't get absorbed through a leaky gut situation. So eating mushrooms actually is beneficial in preventing leaky gut syndrome in certain cases. So a company's put together a shredded mushroom mix, which you can get online, and that's given to these horses with EOTRH. The problem is veterinarians laugh at this. And when I say they laugh, I listened, and at the American Association of Equine Practitioners Conference, where Dr. Dixon was the guest lecturer, somebody asked about EOTRH and the use of shredded mushrooms as a treatment. And everybody chuckled. Even Dr. Dixon and Dr. Easley was on the panel. They just started chuckling. They started laughing. And I didn't know what to think. I mean, I don't know. I was just listening until Dr. Dixon said, well, if you have to push me in a corner, I believe that it's an autoimmune disease. And at that point, all the light bulbs went off, because the word autoimmune and the words mushrooms have a correlation, have a treatment plan in humans. And so for the past 3 years or so, I've been recommending the feeding of shredded mushrooms through a company called Equine Matrix, I think it's called, and it's Equident. And every horse has been put on Equident. The inflammation is stopped. Even in one horse that the owner said, no, I'm never going to stop feeding my horse grain. I'm going to continue to feed grain, but I'm going to add Equident. And she reported back 2 weeks later. She says, for the first time, my horse seems happy. He's running through the field. He is immensely grateful. And I've seen this horse several times since she put the horse on Equident, and the inflammation has subsided, but the damage is done. It's permanent. It's never going to go back to normal. And every horse that has a choice of not feeding any more grains, but I don't think anybody has done a controlled study, or as controlled as possible, where they take a horse with active EOTRH and find some sort of parameters, whether it's on x-rays or clinical signs that we grade, and have an independent observer grading them, and then just take the horse off grain and see if the inflammation stops. I don't know. But we've got to stop it so it doesn't become worse. And you can also get the pain away from some of these horses that have painful teeth by putting them on the Equident or taking them off grain, or both. These horses will just be happier. So there's a correlation, I believe, between feeding grain and the beginning of this disease, and the disease just progresses. And I don't know how to stop it other than to use shredded mushrooms or stop feeding grain. But that's EOTRH. I do not believe in extracting teeth unless you can take them out with your fingers. And I've done that. I've gone up and the tooth is just wiggling. I mean, you take your fingers and wiggle it back and forth. If you pull hard enough, the tooth's coming out. Fine, take it out. The tooth is dead. A lot of these teeth are so dead, there's no pain at all. So I can take them out with my fingers and the horse just stands there looking at me. But I don't go immediately pulling teeth that are healthy, that it's painful to remove. I try to get the pain eliminated by removing grain and giving Equident. And then if the horse continues to be happy, that's great. And if the tooth continues to loosen and starts flopping out, or it starts to fracture because it's abscessed, fine. I have no problem taking the tooth out. The biggest problem I have with removing teeth is simply seen if you go to thehorsesadvocate.com and look at the subject called Aging Horses by Their Teeth. And I have I have thousands of pictures of horses taken of the side view of their teeth, the left side, the right side straight on, and then looking down at the lower occlusal surface and talking about aging horses. But what I found was, if you look at the side view, the tongue of every horse that's resting and relaxed is pushed straight up behind the teeth. So when you're looking at the horse at the side, you lift the lips, you'll see the tongue is pressed hard against the incisors. And if you take videos of your horse grazing, harvesting grass, you'll see that the tongue is pushed out and licks the grass up, and then they snap the head and snap the grass off, and then the tongue goes back out. Every time it goes out, it's like a person pushing through a swinging door. It just pushes the door and the jaws open up. And I believe that that action year after year after year causes the incisors in a young horse that's vertical to become more and more horizontal as the horse gets older. So if you look at an older horse's mouth from the side, the teeth are more like a 45-degree angle, whereas a young horse, they're more like a 90-degree angle to each other. And I think that's just tongue movement over time. So the horse depends on having those teeth there to keep the tongue in the mouth. And when you extract the teeth, the tongue's going to flop out. They sit there looking at you like they're an idiot with their tongue just sticking out. And I have pictures of that on my website of horses that don't have incisors, and the tongue just sticks out like, you know, a bad kid sticking their tongue out at you. It just doesn't go back. Even taking out half the teeth, the tongue can slip out off to the side because the horse doesn't consciously try to keep the tongue back. They can pull it back, but at rest, no, they just let it sit behind the front teeth. And when you extract them, it comes out. Now, there's no harm in doing that, but it just looks silly, and I don't think the horse actually likes it. But what do I know? Okay, so that's all I want to say about equine odontoclastic tooth resorption and hypercementosis, EOTRH. You read more about it in the blog I wrote. You can also look at all the images I have. And again, if you have several $1 million, I will guide those monies over to somebody who I think is competent to do some studies. Or maybe even Dr. Dixon would take your money. But we would definitely need to work out even a retrospective study if we could positively identify what the cause is and is it grain? And if it is, then that's another reason why we've got to stop feeding grain to our horses. All right, let's move on. There is an article from the British Equine Veterinary Association called Dental Health and Management Practices of Donkeys in the UK. That's the United Kingdom, for those of you who don't know what that is. And it says, what should we be considering? Now, this is an interesting study. And as you know, when I read these things, I tend to be cynical or I question everything about it. And that's the way I've always been. When somebody tells me some stuff, I'll ask questions. And I'll say, but what about this or what about that? And if I get more questions than I get answers at the end of the program, I finally say, well, I don't think what you're telling me holds a lot of weight. And right now, while I think these people are, you know, wonderful, I mean, I have no problem with these guys are associated with the Donkey Sanctuary, which is big in the United Kingdom. They help donkey owners around the world. Remember, donkeys are considered beasts of burden throughout the world. There are so many of them with, I believe, last time I checked, I may be wrong, but Ethiopia having more beasts of burden per capita, which means more per people in the population than any other country in the world. And they're still used to carry things. So the Donkey Sanctuary takes care of this, and they would like to get some dentistry taken care of in these donkeys, whether it's at their sanctuary or training people, so owners of donkeys throughout the world can offer good dental care. So that's their goal. Or actually, I'll just read the objective right here. The aim of this study was to identify relationships between dental health and current management of donkeys in the UK and to provide recommendations to improve practices to help donkey welfare. So it's basically study the donkeys at the Donkey Sanctuary, so they don't go out in the real world. Now, apparently these donkeys are taken in. They're having a pre-admittance, what do they call it? A pre-admittance exam. And then they have the admittance exam, and those two exams can actually differ, but they relate a lot of things. So they used 596 donkeys surrendered to the donkey sanctuary over a period of 30 months. They looked at three things. They looked at the entrance information submitted by previous owners and welfare professionals, the pre-admission clinical examination records, and the arrival medication examination data. So those are the three things they had, and their results were no statistically significant differences were identified between dental health and provision of bedding or diet types. Agreement between external professionals and experienced TDS staff was weak in reference to recognition of dental pathology. That's not good. Age and body condition score. Over 25% of donkeys with severe dental pathologies also had poor BCSs, or body condition scores, of 1 to 1.5. Remember, just as a review, the BCS goes from 1 to 9. 1, they're on death's row. They're nothing but a walking skeleton. 9, they're so fat, if you threw them in the pond, they'd float like a fishing bob. And I have plenty of pictures of 1 through 9 on the website. The majority of donkeys had no indication of previous dental exams. Conclusions. Regular prophylactic dental care seems to have poor uptake amongst the owners of the study population, but this is perhaps in part aligned to the nature of the sanctuary. Owners are yet to take dental health into consideration when allocating a diet or bedding types to their donkeys, presenting a risk of colic or choke in those fed long fibers with an inability to process them adequately. The Donkey Sanctuary should continue to offer accessible means of education to reach both professionals and owners alike, and this may be well served by the implementation of the new online Donkey Academy. We all look forward to having the Donkey Academy online, but if they continue to give some information like this, I'm going to continue to do podcasts to ask questions. So I'm going to skip over all the middle stuff because it's just a podcast. If you want to look into it, you can find this in the Equine Veterinary Education Journal. And let's see if it's someplace else. Research and Operational Support Department, the Donkey Sanctuary in Sidmouth, United Kingdom, in the Department of Animal Pathology, Faculty of Veterinary Sciences, Instituto, I don't speak this. It's in Spain. So the Spanish veterinary school. So they do all these materials and methods, which is always important to read, and the results, always important to read, then the discussion, and you should never, ever, ever make assumptions without looking at the materials and methods. If you don't believe me, listen to my podcast called The Parachute Study, which was just an embarrassing parody put out by the British Medical Journal, one of the most prestigious human medical journals, that basically said you can jump out of an airplane without a parachute and survive the landing. And if you didn't read that one half sentence way down deep in the materials and methods that said the plane was parked on the ground and the door was only 6 feet off the ground, you would have missed the whole idea and thought that maybe it's okay to jump out of an airplane without a parachute. So, but I did read that, and I did go over the discussions, and they basically said the older the animal, the worse the grade of tooth problems. And they graded the teeth on, I think it's 1 through 5, with 1 and 2 grade dental grades being acceptable, and 3, 4, and 5 being unacceptable. And out of all the horses, 341 had a score of 1 or 2, which is acceptable. And those that had pathology scored 3, 4, or 5 was 115 out of the total. They tried to relate this to bedding. There was no real significant relationship to what they were bedded on. They looked at their diet. They had grass, they had restricted grazing, they had hay, They had straw, haylage, chop forage feed, fiber compound feed, cereal grain, that's grain to all of us, and supplemental balancer. And I thought that was interesting because, okay, I already said they didn't see anything with bedding, but with the diet, it said donkeys have evolved to browse and graze highly fibrous plants of poor nutritional quality. That was from a study done in 2001. Diets should therefore be fiber-based, and feedstuffs high in starches and sugars should be strictly avoided. That was a study done in 2013. A diet based on fibrous forages with controlled access to grass, especially in places such as the UK where grass is abundant, is reportedly sufficient for most donkeys. Now, you and I, if you've been listening to my podcast, know that forage is basically made of starch and cellulose, or what they call non-structural carbohydrates and structural carbohydrates. You also know that all starches are digested into molecules of glucose, and all animals can do that, but no animal on the planet, including the horse, can digest cellulose. So the gut bacteria will digest the cellulose and break it down into short-chain fatty acids. So it says statistically significant differences are found between origin region and straw diet. So then it breaks down Scotland, Northern Ireland, the West Midlands, and the Northwest. So that basically is boiling down to those that fed straw had horses that were in better shape. So we all know that dental caries in humans is strongly associated with sugar. So the more sugar you feed, or starch, or hay, or grass, or grains, you're going to have more dental pathology than those who are just being fed fiber, such as straw. Remember, when grain is harvested, what's left is the stalk, or what they call straw. If it's a grass or a legume and it's harvested, they harvest the whole structure, and that's called hay. So straw is basically things like wheat and rye, barley. The grains are harvested and used for making bread or beer or whatever. And what's left over on the ground, they bale up and they call it straw. They talked about impaction colic. It says impaction colic in horses with dental disease is correlated with long fiber presence in the large colon, caused by compromised ability for adequate mastication, according to these two people who studied this in 2003. I disagree. There may be a correlation that these horses with bad dental disease or bad mastication may have long grain, but I'll bet you $1 that if you did a gut microbiome analysis, you're going to find that they had a poor gut microbiome, because those are the things that digest cellulose. Horses and all animals cannot break down cellulose. The only thing that can break down cellulose are the bacteria in the hindgut. That's why horses can eat grass all day and do great. But if their gut microbiome is compromised because, I don't know, they're stressed, they're using a beast as burden, they don't have any adequate turnout, they don't have a variety of plants, they hate their life, I don't know what, but whatever might be causing that gut microbiome to change, that's what's causing these horses to not digest their fiber. The purpose, and this is just me, I have no proof, but as far as I'm concerned, if the teeth work, they can make a swallowable bolus. If they don't work, they're going to cough it up. Now, what causes choke? I'm not sure. I don't know if anybody knows. I know that alteration of the paralysis or decreased muscular contraction of the esophagus can cause hay or anything to go halfway down and just stop, and then you have a choke. But they can choke on pellets, on hay pellets, which is as finely chewed as possible, but they create this clot or clog in the esophagus and they'll choke. So for them to say that it's long fiber that's not chewed properly just doesn't make sense to me. I've seen horses choke on hay cubes and on pellets. So I can't say that it's just hay. And I've seen, literally have visualized with an endoscope a foal that choked on a few blades of grass. Now, God made grass beautifully for horses to eat. So why did this foal choke on that? It just wasn't innervated properly. I was able to clear the choke easily, and the foal never had a problem ever after that. So, well, as long as I knew it. So what is actually causing choke? I don't think it's because the teeth aren't working. I really don't. And impactions, I've heard surgeons pull out from tight junctions in the gut, like the pelvic flexure. They'll pull out wads of undigested hay, and they immediately say, well, who's the dentist? Let's check the teeth. It's the teeth because they're not chewing it. No, they're chewing it enough for the horse to swallow. It's the hindgut doesn't have the bacteria to digest it, which brings up another thing about the diet. I didn't see anywhere in there anything about protein sources. If you're feeding your horse just hay or straw or pasture, and pasture, of course, is always limited because you have a fence up there, you're not going to get high protein. And we also know that protein is mandatory, and the essential amino acids of high quality protein are required to make connective tissue. And connective tissue, we always think of things connecting things, such as muscles or tendons, ligaments, whatever. But we often forget the dentin, which is part of the horse's tooth, is a connective tissue. And with poor connective tissue, my hypothesis is a lot of these fractures that we see of cheek teeth are occurring because they're optimal in protein intake. And all of you who listen to me a million times knows that I believe horses are suffering from chronic protein deficiency. I have no proof, but in their analysis, they saw that these donkeys had poor body condition, also had poor teeth. So, I mean, the cart and the horse, which came first? Is it the bad teeth that cause the poor body condition, or is it because they're not being fed adequate amount of protein, and they're being fed straw, which is high in cellulose, which leads to fat, with little sugar. So there's no sugar for the horse or the donkey to actually use for brain function. Then the donkey's going to start consuming their amino acids, which are the breakdown products of protein, and they're going to convert that into glucose to keep the brain alive. So the horse not only loses fat, but he loses muscle. And this is what happens in starvation. And with that, you're also going to have lousy connective tissue. And that can lead to a lot of problems in cheek tooth integrity. So I don't know. There's no studies, absolutely no studies done at all in dentistry. And everything that they talk about in here is conjecture. I'll read their conclusions and then their recommendations. From the data collected, the authors have identified a variety of areas for improvement in terms of management systems for donkeys with reference to dental health. The basic principles of nutrition, bedding, and the provision of dental care appear saturated with conflicting and misunderstood realities, not taking dental pain and function into account when providing feed or bedding, providing supplemental foods for donkeys with good BCS and dental health, and not providing regular and high-quality dental assessments, for example. So that's a really good conclusion, and it's basically what I'm saying. They're not feeding an adequate diet for these horses, these donkeys. They don't have any protein in there. They're not looking at protein as being fundamental in good dental health. So that would be providing supplemental foods to donkeys with good BCS. And dental health and providing regular high-quality dental assessments, I agree. And dental pain, I can't begin to tell you. I mean, it's not how sharp the teeth are, folks. It's their threshold of pain. It's the ones that have zero tolerance for pain, that a little sharpness in there, and they're just miserable. And I see horses like this all the time. And I just scheduled a horse in my practice for 3 times a year floating, because at even 5 months, the horse still has to be medicated because he hates the pain. And as soon as I take the pain away, the horse is my best friend. I mean, he's, crawling all over me saying thank you. It's all about the pain, folks. They go on to say, failing to take dental health into consideration when allocating diet or bedding types presents an unacceptable risk of colic choke in donkeys fed long fibers with an inability to process them sufficiently. So this is where we disagree. As I've said, the ability to process them sufficiently is having a good, solid, healthy microbiome. And of course, a lot of these donkeys don't have that because they come from very poor conditions. I've yet to see dentistry prevent choke and prevent colic. I think it's helpful, but I don't think it's the be all and end all. I think there are other things that have to occur. Conversely, it seems more common to offer supplemental feeds to donkeys with good dental health, which may attribute to higher BCS scores. So yeah, everyone, if you have money, you're going to get supplements and you're going to get dental health. And those who can't afford it are not going to have it. So I'm just suggesting that these teeth in the equids are very good at keeping them throughout life. And they live for many thousands of years without any dentistry. But they also live for many thousands of years without your supplements and without your grains. And they were migrating animals and they picked up what they could. And they would suffer through times of leanness and they would lose weight. And then times of abundance, they would gain weight and they would go back and forth and their mitochondria would be all healthy. And that would lead to quality in proteins. But the way we're feeding them now, I'm just thinking that it's all a matter of chronic protein deficiency. The data show that recognition of orodental pathologies in donkeys by owners and professionals is deficient. Accordingly, it may be presumed by the high prevalence of disease that the treatment of dental pathologies in donkeys is also lacking, both in terms of frequency and of scheduling and quality. It is clear that the issues surrounding donkey management, especially in terms of dental health, are multifactorial. Owners have an appetite for information, but without knowing the sources, it is possible that this fails to be evidence-based, and accordingly, owners continue to miscalculate the requirements of donkeys. Well, I got news for you. There is going to be no evidence-based studies on donkeys, and if there is, it's going to be biased, it's going to be underpowered, and again, I plead, if you've got several $1 million you want to spend, let's get together and we'll find how to do science correctly and see if we can study this. And by the way, there'll be no income from this. It's just total waste of your money. Okay, I've got one more. I'm getting an alarm set off. This is my last one, then we'll wrap this podcast up. Complications of equine cheek teeth extractions by Patty Dixon. I can't pronounce his first name, and I don't want to do a disservice. Everyone knows them as Patty Dixon, private surgical consultant in Edinburgh, United Kingdom. He used to be the director of the hospital of the vet school there. And I'll read the summary, and then we'll go into it. Summary: due to the length of the reserve crown and roots of equine cheek teeth, especially in young horses, their extraction can be a challenging procedure with the potential for many types of post-extraction complications to develop. The prevalence of post-extraction complications is greatly influenced by the exodontia technique used. That's how they take the tooth out, with unacceptably high levels of complications with the traditional repulsion technique, and conversely, low levels of complications with oral extraction performed by skilled operators. I'll come back to that in a second. Recent objective studies on post-exodontia problems or post-extraction problems in horses have also highlighted some risk factors for the development of post-extraction problems, including exodontia of rostral mandibular teeth. That means the first few cheek teeth on the lower jaw in young horses, and extraction of teeth with apical infections, or they have an infection in the bottom of the tooth, the root. The recent recognition that some non-healing post-extraction equine alveoli, that's a socket, suffer from a disorder very similar to dry socket in humans may help clinicians to recognize, treat, and possibly help prevent this disorder. Dr. Dixon, I really, really appreciate all the work that you've done in looking at cheek teeth and helping veterinarians understand what they're made of, how they operate, and so many other things that you've been part of. I'll never forget actually sitting down with you one-on-one in 2002 at the BEVA meeting in Glasgow, Scotland, where you and I talked about incisor reductions, and you told me, quote, "We're rapidly moving away from incisor reductions here in the United Kingdom." And then Dr. Lauder from the University of Georgia, a few months later, the AAP wet lab mirrored exactly what you said, saying we're rapidly moving away from incisor reductions here in the United States. I thought it was funny that you both use the same expression, rapidly moving away. And yet people are still filing down the front teeth and talking about balancing the mouth. So I think we haven't really reached that group of people. But that's an aside. We're talking about complication equine cheek teeth extractions. I listened to you at the AAP meeting when you came, and you were the prime speaker. And then you came and talked the next day to us in a more, what's the word I'm thinking of, a group of, closer group of people who are really interested in what you had to say. And for that, I'm forever grateful. But there's one thing that really stands out in this. Basically, what you're saying is the old way of popping cheek teeth out was to create a flap or some sort of hole at the root of the tooth, and then driving it out through blunt force trauma of placing a punch and then taking a hammer and literally hammering the tooth out. And I mean, you're right. The number of complications, I'm telling people between 50 and 70% of those horses have complications. They are horrendous. And it's much better just to not take the tooth out if that's how they're going to do it. There are broken teeth, which you address in here, that make it difficult to take them out intraorally, but you've addressed that in this article. But the first way that we normally took teeth out was we just punch a hole. We made a hole in the skull, and then we put a punch in and we hammered it out. That's the way I was taught in vet school in 1980. And nobody had any other way. Since then, somebody suggested that they take a slice of the cheek and open the cheek up so you had access to oral cavity from the side, and then you could actually work in there from the side and take the teeth out intraorally, but through the hole in the cheek. And of course, there are so many complications with that, because even though the cheek looks like just a little bit of skin and muscle, there are a lot of nerves and salivary ducts and blood vessels that go through there that can be damaged. So that's kind of not done as much anymore. Now, the way they do this is they open the mouth up under heavy sedation, and they loosen the tooth by spreading it. So if you have 3 teeth, if you have the middle tooth that you want to get loosened, you basically spread it away from the teeth on each side of it. And then you finally just get it so you can loosen it up, and then you pull it out. I've known some veterinarians to take, I don't know, 3-4 hours to get a tooth out that way, especially in younger horses, because the tooth is so long. I've heard of teeth crumbling when this happens. And then you have pieces of tooth left in the socket. I've heard of sockets breaking as patience is tested, and in the strength of it, they break a little piece of the socket. I've heard of the teeth on either side becoming damaged through this process, and then they become infected and have a problem. And Dr. Dixon goes over all of these issues that can occur. Damage to adjacent teeth is here. Traumatic alveolar damage, that's the socket. Retention of dental fragments. As they're pulling it out, a piece of tooth gets broken off and it's way down in there. What are you going to do? You can't grab onto it very well. And you certainly don't have great exposure to get it out. You have damage to facial nerves, vasculature, and parotid duct, but we went over that. Just don't do that through the cheek one. Infraorbital nerve damage, surgical site infection. Of course, some of these teeth are infected and you're pulling it out, and now the whole world can gain entrance. All the food and all the germs and everything that's inside the mouth. Remember, inside the mouth is still outside the body. Pieces of socket wall gets retained, and then you have bone infection, osteomyelitis. So, and then of course the oromaxillary, oronasal, or orocutaneous fistula formation, which basically means you got a hole from inside the mouth to outside the head. And so the horse is eating and you see food coming out of the hole or out of the nostrils. It's pretty disgusting. And this is the one that really I like. He talks about dry socket in the summary, but dry socket, he says, is very rare in a horse. And finally, continuation of unilateral nasal discharge, which is what I see the most when somebody says the horse has a snide nose coming out of one side, and then they diagnose it as a tooth-root abscess. They say that a non-response to dental sinusitis presence inspissated exudate, which is this dried pus, and bone sequester can cause this. And it can occur whether you take the tooth out or not. In my opinion, taking the tooth out is basically doing a lancing an abscess, if you will. There's pus in there. Pus has to come out someplace. And usually the pus is found a root and it's coming out the nostril and it's draining to the outside. And other than you being disgusted by it, the job is being done perfectly by the immune system of the horse, which is to take an infection, wall it off, and shoot it to the outside. What bothers me the most about this article, Dr. Dixon, and this is, I understand the purpose of this article was to go over the complications, but what complications occurs when you don't do anything? It was the most glaring thing that was absent from this. Where is the study where we take 500 horses that have a tooth-root abscess, an apical tooth-root abscess with a unilateral nasal discharge, and half of them we do nothing. We just turn them out in the field and we check them every, couple of months and go on from there. Because I think what you'd find is, first, these horses will show no signs of a problem. They will continue to chew. They'll be fine on the bit. They have no pain. They could care less. And second, in my experience, these horses that are just ignored finally resolve, and the tooth is fine, and the pus goes away, and everything's fine. But nobody's doing any science behind that because obviously nobody would make any money on that. But the owners don't want to be cleaning up the nostril. They don't want to be going in there every day for over a year, wiping the snot that stinks out of this horse's nostril. It's embarrassing, it's disgusting, and the horse owners won't stand for it. So they demand of their veterinarians to do something, and so they do. And to my good friend out in California who graduated from LSU, who's a veterinarian now, before she got into vet school, she had a horse that had one of these discharges, and we worked on it for a year. I said, trust me, it's just going to take care of itself. But she got into vet school, and for that reason, she went ahead and had the tooth extracted. It was an upper left cheek tooth, had it extracted, and what was happening was pus was coming out of a hole in the face. And while I agreed taking the tooth out would probably resolve that, I also had a lot of concerns that you have a problem with it. And sure enough, that discharge out of the hole in the face continued after the tooth was extracted. And so they decided to take the second tooth out next to it. So it took 2 teeth out. And finally, months later, that drainage stopped. And it was so frustrating because, what would have happened if she just did nothing? She had a cruddy face. She had to clean up all the time, but the horse never showed any complications from it. And if we look and did our due diligence and scoured the internet or scoured medical records and did a retrospective study, I think the number of horses whose demise have occurred from a bad tooth are very, very limited. I haven't seen any. I haven't heard of any horses that had a bad tooth and died because of it. It It doesn't seem to have happened. Yet case after case after case of complications from tooth extraction occur. So why are we so, why do we rush to take the tooth out? And it's only because a horse owner wants us to. And again, just because we can, should we? Pardon me. So I think that's all I want to say about equine dentistry. After I've done this since 1983, that's a long time. That's 40 years of going out seeing horse after horse after horse. Maybe it's going to bite me in the butt one day, but it hasn't yet. And I've had horses where I just say, just turn the horse out and don't worry about it, because the owners don't have the money to even do tooth extraction. There's nobody of high quality to do it. And as Dr. Dixon said in this article, the complication rate is dropped provided you have somebody with experience who knows what they're doing. And unfortunately, if you don't live in a horse dense area with expertise, such as somebody at a university who does a bunch of them, if you live out in rural America or rural Europe or rural Australia or South America or Asia, just anywhere that you don't have a good quality veterinarian to go in there and extract the tooth, you may be creating more damage. These teeth are in there for a long time. They are meant to keep chewing for as long as the horse is alive. And these teeth have evolved to be very good no matter what. And we have to stop getting these fractures in the teeth. We have to stop getting dental caries, which we call cavities, which didn't occur back in the 1980s. Or if they did, much rarely. I mean, if we go back to the 1800s, I wonder if we were having cheek tooth fractures. I know that in my vet textbooks, they didn't exist. I don't remember seeing, hey, here's what's going to happen with a cheek tooth fracture. They just weren't there. All you had to do is open the mouth. You could even take an old-fashioned camera and take a picture inside a horse's mouth if you're lucky. And that picture would have served all of us in every vet school, but I don't recall seeing it. It suddenly occurred. And as they started occurring, they became more common. So it still goes back to, are we feeding them right? Do they have dentin? Are they getting way too much sugar because you're feeding them hay 24/7, 365, which is loaded with sugar because the grass that's being cut has been genetically modified to have a higher sugar content for greater milk production out of cows, just as an example. So there you go. I've filled your head with three things: equine odontoplastic tooth resorption, hypercementosis, the correlation of body condition score and dental health in rescued donkeys that are brought to the donkey sanctuary in Great Britain, and Great Britain's master of dentistry, Patty Dixon, and his article on fractured cheek teeth in horses and complications from extraction. Pardon me, I said that wrong. It was not about fractured cheek teeth in horses. It was about just extraction of whole teeth from horses. And it has nothing to do with fractured cheek teeth. So again, if you have hundreds of millions of dollars, Mr. Musk, are you out there? Do you want to buy a horse? Let's get some money put aside and start doing some of these studies. And until then, let's get some of our heads together, some people who have done this for decades, 30 or 40 years or more, and just say, okay, how many of these cases have you seen? What have you done? What's the outcome? But nobody's knocking on my door. Nobody's saying, hey, doc, you've got a brain and you see a lot of horses. What about this? Give me a questionnaire. Ask me questions. Have me do a survey over the next 12 months of all the horses I see. And let's get all the other dentists out there. Let's start a survey. How many horses do you see with EOTRH? What's their diet? I mean, yeah, it'd be a little bit of work, but gosh. What would happen? What would happen if we found that all this is caused by feeding grains to horses and not feeding enough protein? I mean, you're going to hit a huge, insurmountable wall of all these grain companies who are making lots of money selling horses grain or horse owners grain. And if all the horse owners said, gosh, now that I know that it's affecting my horse's teeth and my horse's gut microbiome and all the other things that are going on, maybe I don't want to buy grain. Well, that's going to get a couple of companies mad. And I understand that. But I'm just leaving it here with horses need our help. We need to help the horses survive and thrive in a human world. You and I are trying to thrive in a human world, and we have crazy people driving out on the interstates. We have 90% of the grocery store, we shouldn't be buying their food because it's ultra processed and loaded with sugar. You know, we got to get away from convenience, and we have to start looking at what's important. And that's the message that I'm trying to get out with this podcast. Anyway, that's all I got time for this time around. I hope you enjoyed it. I appreciate you being here. And I'll be back next week with another podcast about something interesting. And if any of you have a subject you want me to cover, let me know. I get some pretty interesting questions at the Horses Advocate. Members there get to talk to me live every other Thursday night, where we talk about ideas. A lot of it's still based on nutrition, but people have some pretty interesting questions, and I try to do my best to answer them and help people help their horses thrive in a human world. Okay, that's it. Doc T, and we'll talk to you next week. Bye. Hey everyone, Doc T here. Thank you for listening to my content. Would you do me a huge favor? Would you please subscribe, comment, like, thumbs up, and give a star review? However it's presented to you, I want you to do that. There's two reasons. The first, of course, is to improve this product. This way I know what you like, what you don't like, what I can improve upon, what topics you want me to cover. But more importantly, it's also going to help others find me. And by doing that, you are now engaged in this mission of helping horses thrive in a human world. By you helping, we can reach others. And that I would be so grateful for. And remember, go to thehorsesadvocate.com for updates on this information. Thehorsesadvocate.com. And again, thank you so much for being here. Doc T out.